Hello, I am Dr. Nadeem Shah working in a hospital in Saudi Arabia, and today I want to talk about macrovascular complications of diabetes. First of all, what is diabetes? It is a long-standing disease in which blood glucose or sugar level is higher than normal, which occurs when body is unable to produce or use insulin. What is insulin? Insulin is a hormone secreted by our pancreas which is needed to shift glucose from the bloodstream into the tissue cells where it can be utilized to produce energy. There are two types of diabetes. In type 1 diabetes, the pancreas cannot produce insulin at all, whereas in type 2 diabetes, there is either insufficient amount of insulin or body is resistant to insulin action. Diabetes can cause short-term as well as long-term complications. The long-term complications can be further divided into microvascular and macrovascular complications. Micro means small, whereas macro means large. Therefore, microvascular complications are related to small blood vessels involving eyes, kidneys, and nerves, whereas macrovascular complications are linked to large blood vessels affecting heart, brain, and lower limbs. Now we will see how macrovascular complications arise. The main culprit for macrovascular complications is atherosclerosis, which is caused by the formation of atheroma or plaque made up of cholesterol, fats, calcium, and other substances. Higher blood glucose level damage the inner lining of blood vessels or blood pipes, promoting deposition of cholesterol in the vessel walls, accumulation of which over a period of time result in progressive narrowing of blood vessels, and this process is known as atherosclerosis. The narrowing of blood vessels reduces blood supply to the part it supplies, and as the process of plaque formation continues, the end result is complete blockage of blood vessel. Sometimes the plaque dislodged from its actual site and blocks some other blood vessel in a remote area. If atherosclerosis involves blood vessel of heart, it can cause myocardial infarction or heart attack. If it involves blood vessel of the brain, it can result in a stroke or cerebrovascular accident. Whereas if it affects the blood vessel of lower limbs, it can lead to peripheral vascular disease. Studies have shown that the most common cause of death in people with diabetes is cardiovascular disease, and around 65% of deaths in patients with diabetes result from cardiovascular diseases and stroke. The patients with diabetes experience heart attack 15 to 20 years earlier than their non-diabetic counterparts. If you have microvascular disease, you have 10 times higher chance of developing cardiovascular disease. Now we will see them one by one. When atherosclerosis affects blood vessels of the heart, it can lead to MI or heart attack, angina, heart failure, or even sudden death. When the blood supply to the heart is blocked, the heart muscles are damaged, resulting in heart attack, and patient may present as severe chest pain, chest heaviness, or difficulty in breathing. Sometimes the patient may not experience any symptom because of diabetes and is known as silent MI. In brain, the decreased blood flow or blockage of artery by atherosclerosis may result in transient ischemic attack TIA or stroke. In transient ischemic attack, the symptoms are present for minutes to hours but less than 24 hours, whereas in stroke, the symptoms are present for more than 24 hours. The symptoms may include weakness or numbness on one side of the body or part of the body, or difficulty in speaking, all dependent upon the area of the brain supplied by the affected artery. Similarly, blockage of blood vessels supplying lower limbs may present as intermittent claudication, in which the person feels pain on walking, which is relieved with rest. It can lead to foot infections, foot ulcers, and amputation. Peripheral artery disease is the leading cause of non-traumatic amputation. Patients with diabetes have 16 times higher risk of amputation as well. There are also risk factors that predispose to the macrovascular complications, and these include high blood pressure, high cholesterol, overweight, sedentary lifestyle, diet, smoking. For the management of macrovascular complications, it is necessary to control the risk factors. So we will see them one by one. Blood pressure should be checked at every visit to doctor, and too high recordings on separate occasions are required to be labeled someone for hypertension. In diabetes, blood pressure should be below 140 over 80, and in young person it should be below 130 over 80. Blood pressure can be managed by decreasing salt intake to less than 1500 mg per day and lifestyle modifications. Medications may be needed once blood pressure is above 140 over 90, and these include angiotensin converting enzyme inhibitors, angiotensin receptor blockers, and calcium channel blockers. The lipid levels in blood should be measured at every year, and the recommended target levels are less than 4.5 millimole per liter for total cholesterol, less than 2.6 millimole per liter for bad or low density cholesterol when there is no cardiovascular disease, and less than 1.8 millimole per liter when there is cardiovascular disease present. Similarly, the triglycerides should be aimed below 1.7 millimole per liter, whereas high-density lipoproteins, which are good lipids, should be more than 1 millimole per liter in men and more than 1.3 millimole per liter in women. If your lipid levels are high, you need to change your lifestyle. Your physician may suggest you a medication such as statin. Statin is recommended if you are above 40 years and have cardiovascular disease. If you are below 40 years and have at least one cardiovascular disease risk factor, you should receive statin no matter what are your lipid levels. Niacin and fibrates are other anti-lipid medications that are effective if the triglycerides are higher. I also talked about lifestyle interventions in my previous slides, but what does it mean? It simply means that a person should modify his lifestyle to bring healthier change to his diet, body weight, and physical exercise. A healthier diet should have limited amount of saturated fats such as animal fats, coconut oil, palm oil, and also reduced amount of cholesterol which is present in red meat, organ meat. However, it is better to take more polyunsaturated fatty acids, monounsaturated fatty acids, plant sterols, fish, and fiber. Good amount of fruits and vegetables also constitute a healthy diet. If a person is overweight or obese, he should lose weight. Studies have shown that moderate weight loss of 5 to 10% improves blood glucose levels. Therefore, it is suggested to take 1500 to 1800 kilocalories per day for men and 1200 to 1500 kilocalories per day for women. If your lifestyle is sedentary, you should change it to increased physical activities. Exercises of moderate intensity for at least 150 minutes per week or 20 minutes per day for at least 5 days per week are recommended for your better health. High intensity exercises for 90 minutes per week can be performed if there are no contraindications. Smoking is another important risk factor for macrovascular complications as it increases insulin resistance and also increases the risk for cardiovascular disease and stroke in patients with diabetes. If a person is a smoker and have diabetes, he must quit smoking. For smoking cessation, healthcare provider can help you in various ways such as counseling and prescribing medications such as nicotine replacement products, bupropion, varenicline. Summarizing, the macrovascular complications cause significant morbidity and mortality in patients with diabetes, which are preventable if you control your blood pressure, lipid levels, adopt healthy lifestyle, as well as avoid smoking. Thank you.